So my name is Sarah Manning. I've been a yoga teacher for the last 26 years, and all of that time I've worked with women. The pelvic floor. So I'm going to spend the next 10 minutes talking about the pelvic floor and see if we can get some of the subtleties involved and educate you a little. So let's start with an understanding of where the pelvic floor. If this was my pelvis here, okay, let's have a look at the pelvic floor. So we have a pubic bone, and we've got a tailbone, and then we've got, these are our sit bones here. So when we sit down, that's what you're feeling pressing into the floor. So this whole area is considered to be the pelvic floor. And it's not just flat, okay? There's parts of the pelvic floor that actually come this high, okay? So it goes from here to here, all right? So it's all inside the pelvis. So let me just show you my preferred reference for all things pelvic. And she has some amazing drawings. Yeah, let me just give you an idea of some of the drawings. And her activation of the pelvic floor is where I usually start. All right, so you're going to be teaching an awareness to your patient or your student. And the first thing we have to do is make sure that we are either sitting or kneeling. I prefer kneeling, so I'm going to place a block between my knees and I'm going to sit on it. If that's not quite tall enough, then just get a cushion so that you are sitting completely comfortably. Center of gravity of head, chest and pelvis is aligned, so there should be a curve in the lower back so that everything is now in correct alignment. Don't try to do pelvic floor exercises when your tail is tucked and those muscles are already engaged. It's not going to help you. So start in neutral spine. And then invite your patient or student to find the pubic bone and the tailbone. And so the first action you're going to do, you can't move the bones, but what I want you to do is to imagine you can tone the muscle fibers between them by drawing them. Imagine drawing these two bones towards each other. Inhale first. And as you exhale, see if you can get a sense of toning from the pubic bone to your tail. Okay, so that's the muscle fibers from here to here. Let's do that one more time. Inhale and exhale, tone. All right, now we're going to add on. Facing forwards, inhale first, pubic bone to tail, and now imagine those sit bones and draw them. So get those muscle fibers from side to side, the lateral fibers to be engaged, and relax those. Again, inhale, pubic bone to tail, sit bones to sit bones. Now notice I'm not asking you to tilt your pelvis or move anything. I'm looking for a toning, all right? All right, next, we're going to engage the muscles that travel up the inside of the bowl, okay? So imagine we've got a pencil and you're going to just grip and hold this pencil just softly. We don't need to grip it firmly. And then we're going to lift internally, all right? So breathe in first. Grip the pencil. Can you feel how we're going front to back, side to side? All right, now see if you can lift internally. 1, 2, 3, and release. 3, 2, 1, let go of the pencil. One more time. Inhale first. As you exhale, grip the pencil, forward and back, side to side, and lift internally. 1, 2, 3. Release. 3, 2, 1. Drop the pencil. All right, so that's the basics, but the subtlety is what we now need to talk about. So pelvic floor Kegel exercises. There's been an enormous amount amount of debate about whether they should be done or not, particularly for pregnant women. I've been working with pregnant women the whole time. So in my humble opinion, trauma, and that includes childbirth, it includes pregnancy. So even if you have a C-section, there can still be damage, not necessarily physically, but in the connection between the brain and these muscles and how they work. So let's just talk a little bit about the two kinds of muscles in the body. And I call these muscles the macho muscles. These are the muscles which move bones. They're on the outside. They tend to cover large areas. So the trapezius, from the back of your neck to the top of your shoulders to your lumbar, this would be a macho muscle. Its total emphasis is moving bones. They're dramatic. They are on or they're off. Now, let's talk about the other muscles. I call these the feminine muscles. The feminine muscles are very good at hugging. These feminine muscles have an action of hugging, but it's intelligent. So sometimes they need to hug really tight, and sometimes they're just holding you. Just the softest communication that they are there for you. All right, so the pelvic floor is part of these hugging muscles. Intelligent, but they also tend to work in a team. Women, yeah, it takes a village to raise a child. We are used to collaborating. We're not expecting big drama from one individual. So when the pelvic floor lifts, the transverse abdominis engages. These are the really deep abdominal muscles, all right? And they are part of hugging, protecting, and aligning the spine and the pelvis. So the next is a very simple exercise that we do at the beginning of Qigong, all right? So I'm going to invite you now to just lie on your back. And what we're going to do is we're going to flex our feet, all right? So inhale first, totally relax. And then as you exhale, pull your toes towards your knees, flexing your feet. Inhale, relax. Exhale, flex, and start by being grateful for those beautiful toes and the arches in your feet. And relax. Now we're going to start noticing, focusing inward. Flex. Notice your toes and your feet, but also feel that energy moving upward into your kneecaps, into your thighs. And release. One more time, and flex. Feel the feet, the knees, the thighs. Can you also feel the pelvic floor just softly saying hello? And maybe even the transverse abdominis, just above the pubic bone. Can you just feel a bit of tone there? So these are stabilizing muscles that we are just joining in with the flexing of the feet. All right, relax for a moment. So this time we're going to flex the feet and we're going to lift one leg, and I want you to notice how the hugging action of that pelvic floor, we call it functional pelvic floor professionally. All right, so feet are hip distance apart, flex the feet, and just lift one foot up very slightly. So just of all, let's just look at the toes and the arches in the feet, the kneecap, thighs. Maybe you can feel the pelvic floor, maybe you can feel the transverse abdominis, but can you feel how the pelvis is tilting and the core muscles are just holding it so that it doesn't completely fall over? Okay, so the hugging muscles are activated. All right? Okay, lower that. Feel everything melt. Hugging no longer required to that same level. Intelligent. All right, let's do it one more time. This time the other leg. So taking your awareness inward, Feel that energy of lift all the way from your feet, through your legs, through the pelvis. And now notice the pelvis is tilting, but can you also feel that the shoulders are actually doing a counter movement to give stability? So this is the interconnectedness of those hugging muscles and the fascia within the body as well, all right? So the whole body is interconnected, and the value, the importance of these muscles has consequences all the way from your toes to your crown to your fingers. All right, bending your knees, roll onto your side and push to sit up. So, is there anything else that I wanted to tell you today? So we've covered how, first of all, where it is, where is the pelvic floor. We've covered how I teach how to do it. Oh, I haven't talked about the diaphragm. All right, so let's talk about the feminine muscles just a little bit more, okay? Because I want you to notice that the diaphragm has an impact on those muscles. Okay, so I'm just going to get comfortable. Give me a second. So, the diaphragm, it is a big sheet of muscle beneath your ribs. When you breathe in, that diaphragm descends, and when you breathe out, the diaphragm goes back up underneath the ribs. Every breath the same. The ribs, if you think of the elbows, the ribs open, the ribs return. All right, so this is your diaphragm. In, breathe out. Now, what happens is, let's look at the pelvic floor now. I'm going to breathe in. The diaphragm descends. The pelvic floor also descends physically, all right? It may not lose its tone, but physically there is a parallel movement. When the diaphragm lifts up, you breathe out, the pelvic floor also moves up. So this constant, this beautiful dance, this poetry within the pelvis, within the belly, from the diaphragm affecting the organs inside and the pelvic floor. So that is why we always, when we're testing the pelvic floor, breathe in first, so the diaphragm descends, and then as you exhale, that's when we grip the pencil and lift internally. And lower. That's your breath in, and tone. Now, because I'm teaching pregnant women, I actually, when I teach a pelvic floor exercise, I teach it slightly differently, because I want them to get into the concept of, I'm going to deliver this baby, and each exhalation I'm going to release and let go of all tension and release my baby downwards. So let me show you how I teach a pregnant woman with the idea of thinking about childbirth. All right, so and you'll notice that I use an extra breath in and release on the exhalation. All right, so let's start. Inhale. As you exhale, grip the pencil softly, internally lift. 1, 2, 3. Now I'm going to ask you to take a breath in. And so we're going to use this concept of release and let go. 3, 2, 1. Whoa. Completely open, completely let go. One more time. Notice the difference. In. So this time we're going to stay with the pregnant woman, and then I'm going to show you how, finally, how I would encourage you to do it for someone who's not pregnant. So, pregnancy. Inhale. Exhale, grip the pencil, lift internally. 1, 2, 3. Take a breath in. Think about childbirth. Exhale as a release, and 3, 2, 1. Let go. All right, so non-pregnant woman now. So breathe in first. And as you exhale, grip the pencil and lift up. 2, 3. Inhale, release. 3, 1, let go. Exhale, grip and lift. Inhale, release, let go. All right, and now I can't remember whether I've talked about how the macho muscles muscle in. So I guess I need to talk about that. I don't think I've covered that. So the body is not just black and white. It's not just feminine and masculine muscles. There is this crossover, all right? So when a woman is faced with, a female muscle is faced with something that's too challenging, it will recruit some help from the guys. But first they have to engage and the guys help. If we don't do that consciously, then the guys just take over and the feminine muscles just go, okay, just do it, okay, as we do. So give you an example. So that lift needs to be soft and slow. So inhale, grip the pencil, lift 1, 2, 3, release 3, 2, 1, melt. Now do it quickly. Inhale, squeeze and lift. Can you feel your buttocks getting involved? And these guys have probably switched off, and all that we're hanging on are these clenched buttocks. Oh, let that go. That's not what we want. So the other aspect to pelvic floor is move slowly and consciously when you're getting an awareness. You want to focus just here on the pelvic floor. All right, that's sort of just like a brain download. I hope some of this has been useful. I've probably forgotten heaps, but never mind, I can come back and tell you some more another day.